For more on our review of the health sector in 2021, we're now joined by Professor Innocent Uja, President of the Nigeria Medical Association, NMA, from our studio in Abuja. Professor, welcome to the News at 10.
Thank you very much and good evening.
So let me start by asking how COVID-19 affected the health sector, positively first, then negatively in the past year, 2021.
Well, let me just say Happy New Year first, and also to appreciate channels for the extensive health advocacy over the last 2 years that we were involved with the unprepared invasion of COVID-19 pandemic. There's no doubt that COVID-19 pandemic has dislocated all sectors of the economy, including health sector. It started with what looked like the health sector, but then extended to all facets of life. As a matter of fact, we were unprepared for, but we quickly rallied around, even though imperfectly, to contain the disease as part of our national response. And I must say that we had a high-level advocacy from Mr. President, but the coordination is not as effective as would have been. However, we want to thank God because God was on our side. Otherwise, we would have lost a large number of people. We started with haphazard approach to the pandemic, to response. We didn't have PPE. We had all sorts of obstacles. But we thank God that eventually we were able to manage. And I must, at this stage, thank Nigerian doctors and other health workers, because while everybody was running away, we were asked to stay back. And this is the circumstance. This is the first time I found where every place is locked down, but the Nigerian doctor the hospitals start to stay open. Of course, justifiably, because the disease was such that we had to contain. We lost a number of our colleagues. May their souls rest in peace, not just doctors, but other health workers. But that is the risk that we face, unfortunately. Unfortunately, to the response to the risks, as far as issues of hazard allowance was not forthcoming, despite the fact that we were prepared and ready to face, it's like a war, to fight a war. And I must say that just like the 2014 response to Ebola, we were also very well prepared for this. And eventually, I think we're catching up with this, despite the fact that we did not know the biology of COVID-19. We didn't. We didn't know the epidemiological characterization of COVID-19. But we still trudged on. And we are lucky, I think we are lucky, because what happened to developed countries of the world, if they had visited developing countries like Nigeria, would have been finished.
All right, Professor.
We never knew that America did not have all that they thought they had, and then Europe. And we now find that we are on the same platform.
All right, Professor, quickly.
The COVID-19 is concerned. So we want to thank God for helping us in Nigeria as Nigerians and Africans.
All right, Professor.
That is not to say that we are perfectly prepared for it. And the response is not, it's just over maybe 60%.
All right,
we need to be prepared. National response will allow for preparedness, response, and also review. We also have to have evidence with statistics of research. What I didn't quite like is a situation where we are told the number of cases that are tested positive. We were not told the number of cases that were tested. That is the denominator, and that would have helped us to plot a graph or plot graphs to look at the trends and see how appropriately otherwise we
all right, Professor, very quickly.
Responding
all right,
to
very
the
quickly.
COVID-19. But by and large, it's still on, and we cannot sit back. We have to
all right,
face
Professor.
It, squarely.
I apologize to cut you in. I apologize to cut you in. Professor, Professor, I sincerely apologize to cut you in there, but I know you've spoken extensively on the assessment of the health sector's response to COVID-19. But what do you think the government should be doing now, I mean, to record sustainable improvement going forward for the year 2022?
Well, there's no doubt that COVID-19 has exposed our nakedness, the level of unpreparedness in the health sector. And it means that we need to sit down and review what has happened and look at ways of improving the system. We know that there are some areas of improvement. For instance, when COVID-19 came, we had only 3 PCR machines in this country. But today, I think we have over 100. And we also are happy to know that the federal government released 950 million naira to each of the federal health institutions, federal medical center, specialist hospitals, and also teaching hospitals to improve the system, i.e. buying equipment, providing isolation wards, ICU, and the rest. And I think that is an appropriate response. But we still have a lot to go. We need to train many of our workforce. And in training them, we also need to create some special incentive, if I can call it special. If you recall, we've been discussing the issue of hazard allowance for close to 6-7 months. And in the end, we found that we've just been giving some paltry sum as hazard allowance. That means that the negotiators of government probably have not done the best they needed to do, because one of the things that had happened, even in the face of COVID, Nigerian doctors are leaving this country. And we must not take it lightly at all.
All right, Professor Innocent Uja, we'll have to end it there.
In the near future. And we should not play with that at all. It had happened before. It happened in 1978. It happened in 1992. And it's happening again.
All right, thank you so much, Professor Innocent Uja.
Only the
we have to leave
it
there, Professor.
Leaving. But at this time, both the senior, the junior, everybody is going.
Professor, we'll have to leave it there. We do appreciate your thoughts.
Every doctor is leaving Nigeria. It means that the work environment...
Professor, we have to leave it there. We have to leave it there at this moment in time. We're running out of time, Professor.
Facilities are not there.
Thank you so much, Professor Innocent Uja, President of the Nigerian Medical Association, for your thoughts there on the news at 10.